Hi, I'm Dr. William Song from Omni Aesthetics. Let's talk about cellulite. I want to tell you about my experiences with cellulite. I've been working on this for over 15 years, and we've kind of looked at every treatment that's been available for cellulite. And so today what I want to do is talk to you about what I find works and what doesn't, and why we are so excited about the newest developments in cellulite. So let's go back a little bit and look at the history of treatments for cellulite. If you talk to any aesthetics professional, cellulite is something that most women complain about because it does affect over 90% of women. And I say women because genetically, cellulite affects mostly, almost exclusively women. And the reason is because the cellulite is caused by these fibrous bands that connect the skin to the fascia underneath. So these bands, called septae, are pulling on the skin and causing that dimpling and rippling that we know as cellulite. So how do we treat cellulite? Well, there's two things that cause cellulite. One, as I mentioned, are those bands that pull the skin and cause the dimpling, and the other is the fat that kind of herniates through these fibers and cause those bumps and dimples that we know as cellulite. So how can we treat it? So one way to treat the appearance of cellulite is to stretch those bands. And when you stretch those bands, it doesn't pull down on the skin as much, and it'll improve the appearance of cellulite. So how do we do that? Well, one of the more popular treatments that we used to do was a treatment called endermology, where we use suction to kind of pull those bands, and you do it all over to kind of stretch those bands, and it did work. The problem is, of course, the bands will retract again, and unless you keep doing it, the cellulite will just come right back. So what's another way to treat cellulite? Well, we can do a treatment where we can reduce the fat that kind of herniates through those bands and causes the cellulite. So we tried doing liposuction to get rid of the fat, but if the bands are still there, sometimes the cellulite looks actually worse after liposuction. So that wasn't such a great solution for cellulite. In fact, when we do liposuction, we have to warn the patients that sometimes the cellulite may look worse afterwards, even though the fat is reduced. So what's another way to treat cellulite? Well, we can still work on the fat, but we have to do it in combination with treating those septae. So treatments like VelaShape, VelaSmooth, where we use suction to pull those bands and stretch them, and then use an energy like radio frequency or lasers to reduce the size of the fat. That combination is a little more successful than just stretching the bands. So those treatments were very popular for a while. The problem again is that it's not permanent. These treatments have to be continued. So eventually patients get tired of doing this, and they do it for a while, and either for just getting tired of doing it, or because it's becoming very expensive to continue to do this, they stop. So we needed to search for something that's a little more permanent. Well, they came up with a device called Cellulase, which is a laser that fires sideways. So the thought was, if we can stick this laser under your skin and then shoot that laser sideways, it'll cut those bands with the laser. This was a treatment that there was a lot of excitement about it, because now we thought we had a way to permanently treat these cellulite bands. Well, it was a great idea, but when we tried it, we realized that this treatment was very aggressive. There was a lot of downtime, a lot of bruising, a lot of swelling, and it didn't actually work as well as we hoped, because we're kind of blindly firing laser beams at these bands, even though we're locating the dimples and trying to put the laser where the dimples are. When we're firing those laser beams, we're cutting blood vessels, we're cutting all kinds of things, and you can get a lot of bruising, swelling. You can get seromas. So that wasn't a great treatment. This patient didn't really love the fact that they had to wait months and months to see the results and for the bruising to go away. So they came up with another treatment called Sylfirm. This one was actually a little blade that you stick under the skin. It was a little device that kind of cut those bands. You stick it underneath and you locate the bands, and then you sweep underneath the skin to try to cut these bands. Now, again, we're kind of doing this blindly. Okay, we can't see the bands. Actually, we can go into location, stick the blade, and sweep around and hopefully cut those bands. But because it was not as precise as we want it to be, we're still cutting blood vessels, still getting a lot of bruising, still getting some complications. And again, we're still missing a lot of those bands that are causing the dimples. So this wasn't such a great treatment. They still do it, but it's not something that caught on. Then they came out with a product called Quo. Now this was nice because it was very simple to do. Even non-surgical doctors and even nurses and med spas could do it. It's an enzyme called collagenase, which breaks up collagen. And what are those septae made of? Collagen. So the thought was, if we inject this on the dimples, we're gonna dissolve some of that collagen and weaken it so that the septae break. So this was a treatment. It actually worked, but the problem, again, is what else is made out of collagen? Well, your blood vessels, your skin, just about everything in your body is made out of collagen. So when we're injecting this, it's not going to be as precise. It's not just going after those fibers, it's going after blood vessels. So you get a lot of bruising and a lot of downtime. And again, it didn't really work as well as we hoped. So what else is there? Well, as a cosmetic surgeon, I kind of almost got resigned to the fact that we're never going to come up with a great solution for cellulite until I heard about this device called Avéli. Avéli is really simple. It's a little wand that has a light at the end. So you stick it under the skin and you can see where the tip is, and you mark out the dimples of the cellulite, and then you press one button and this little hook comes out. So when you identify the dimples, you can hook that dimple, and you know that you hooked it because the skin goes down, the dimple goes down when you pull on the septae, so you know you caught it. It's like fishing. It's really fun, actually. And once I've hooked the band, there's another little button that I press, and a little knife comes out at the end, and it just slices the band very precisely. There may be some blood vessels caught within the bands, but you're precisely cutting the bands and a very small amount of blood vessels that might get caught with it. You're not indiscriminately cutting blood vessels all around the band, just what's inside the band. So you still get some bruising. In fact, you can get significant bruising, but it's not the same type of bruising you get when you're indiscriminately cutting around the bands. So the bruises go away rather quickly, at least compared to the other treatments. And what's really neat is that we know that we cut those bands because the bands pop right up and they disappear instantly. So they don't come back. You might develop new dimples over time from other septae, but the ones that we cut don't come back. So we can permanently treat those deep cellulite dimples that have been so difficult to treat in the past. The other part of treating cellulite is we do need to treat some of those rippling that's around the mild cellulite. And that's not always from the bands, and you can't go cutting every single band because the bands are helping to hold the skin up. So what we can do to treat the skin laxity, if we tighten the skin a bit, it'll help with those finer ripples, and we have a great treatment for that. It's called Sylfirm X, which is a radio frequency microneedling treatment that tightens the skin around the cellulite. So we can do this with other RF microneedling like Morpheus, which is a popular treatment. But if you do a combination of cutting those bands that make the dimples and then treating the skin laxity, the loose skin, we can get some really nice results that last. So remember, I said those dimples, they're not going to come back. The skin laxity, we can treat with a treatment like Sylfirm X, and then we can do a little maintenance on that to keep the skin tight, but this is a lot easier than doing weekly treatments of some of the treatments that we had in the past. So when we do this in combination, and if we use some good products like the Elastin Transform with it, we can get some really great results, lasting results, and we can see the improvement almost immediately. So now we have a great treatment for cellulite, and I can say that with confidence now. In the past, I used to have to dance around it so we can treat the appearance of cellulite, temporarily treat the appearance of cellulite. Now we can treat some aspects of cellulite permanently and then have an easy way to maintain other aspects of cellulite. So if you want to find out more about our cellulite protocol at Omni Aesthetic, give us a call and you can talk to any of our staff and they'd be happy to talk to you about it, because we are all so excited about having a solution for cellulite. And we also now partnered with Cherry, which is a financing company where you can get up to 6 months of interest-free financing for this. So we make it really easy for you. We're looking forward to seeing you soon.